Hey, Dr. G here. I just wanted to talk for a second about COVID-19 and vitamin D. So there was a study that was just published showing, this was in Europe, showing that people with lower levels of vitamin D in Europe had a higher risk of having severe COVID-19. So this led to one of the authors of that study, believe from England or Ireland, saying that, hey, maybe we should have everyone take vitamin D supplements. So that is kind of the feeling out there. Now, I have always been what's called an integrative medicine practitioner, or you might call it alternative medicine, where you integrate kind of the non-drug way to treat things. And I was an early adopter of the, hey, why not take it? You know, so many observational studies. That's where you look at a population and you measure something like their vitamin D level, and they have a much higher risk of a certain condition or certain disease when they have low vitamin D versus when they have higher vitamin D. As an example, coronary artery disease, the risk is much higher if the vitamin D level is low, and the risk is lower if you have good, so-called good or normal vitamin D levels. So we look at that data, but it's observational, so it doesn't prove causation. And evidence-based medicine, which mainstream medicine tries to do, is they say, well, you have to do the randomized controlled trial to try to pick out causation. And so let's take heart disease as an example. So someone recently did a review of 21 randomized controlled trials of giving vitamin D versus placebo to treat biomarkers or cardiovascular disease directly. So they did a review of those 21 studies, and the bottom line was that the supplements didn't reduce anything. They didn't have a significant effect on cardiovascular disease. And this same thing has been found in many of the things that vitamin D, low vitamin D correlates to the problem, but you do the randomized controlled trial and it doesn't pan out. So the alternative doctors, and I even used to do this, would complain, well, the drug companies probably somehow got involved with that study and they don't want vitamin D out there because it's going to cure every disease. And so it's biased, or they didn't give a big enough dose. We give 5,000 units a day. They only gave 1,000 units. No wonder it didn't do anything. So we come up with all these excuses as to why we kept saying, well, take 5,000 units a day, because a lot of times we would see a patient's level get into the normal range when we did that, even though we don't have the hard evidence that we're really helping anything. So what am I trying to tell you with the COVID-19 and the vitamin D level? Well, my feeling about vitamin D is it's critical to get it in the natural way because it's different. If you take a pill, that gives you a chemical signal. The molecule has a chemical signal within our system. So you get a chemical signal, but you don't have the photonic power, okay? So our planet revolves around a star, and that star gives off different frequencies of light, and one of those frequencies, ultraviolet B, which tends to come out in the middle of the day, depending where you are in the planet, activates the precursor molecule, which is 7-dehydrocholesterol. So it collects that ultraviolet B light, a very powerful wavelength of light, one of the most powerful, in fact, it's the most powerful wavelength of light that reaches the surface of the earth, and it doesn't do it all day long. It's just in midday, and there are places on the planet that don't get any of that light for months at a time during their winter. So this powerful light causes a reaction in the cholesterol and allows it to, first it sulfates it and it allows it to become sulfated vitamin D, the precursor or the pre-vitamin. So it then again has to be converted. It's sent to the kidney for the final conversion for the active form of the vitamin. So it needs the photonic power of our star. And that signal is different if you remove that and just take a pill. And I believe that's why those randomized controlled trials haven't panned out in general. They just have not panned out. That's why I don't ever take vitamin D pills. I haven't for over 10 years. I just don't believe that it's good to give your body a signal that's a false signal. It wasn't created in the way that nature intended or God. And so I just don't do it. Could I be wrong? Yeah, I might be wrong. The fake stuff might be good. So you have to make up your own mind. But what I tell people to avoid COVID-19 is do not shelter in place. Do what I'm doing. You know, I would say get your shirt off. You know, normally I have my shirt off in these videos, but there's so many these flies that bite. I need to have less skin area so that I don't lose a lot of blood to the biting flies that are out as we're approaching summer here in Arizona. And they're pretty annoying. So while I'm doing the video, I have my shirt on today. But I'm still out in the sun. There's no ultraviolet B light right now because it's too late in the afternoon. So you got to get out, get your skin exposed, and it's got to be near the midday. The D-Minder app will look at your GPS on your smartphone. You know, smartphones, that radiation from smartphones is another thing that will affect your vitamin D levels. So my phone right now, as I'm doing this, is in airplane mode, so I'm not being zapped by my phone. Because if you're zapped, your vitamin D levels are going to be depleted. And I found that just from clinical practice, getting people in the sun, and they still can't raise their vitamin D levels. And usually when we go deeper, those people have a really bad environment as it relates to man-made electromagnetic fields. So the nature-made, God-made electromagnetic fields, a lot of them are streaming onto me right now from our star. Okay, anyone that man makes, so man duplicates nature, but they don't get it right because they're doing it for expediency, profit motives, and because of that, they don't even consider, well, is it safe to do this, to bombard the whole earth, the plants and animals with these? And it has an impact on vitamin D. So if your vitamin D will not come up with good, healthy sun exposure, you got the D app and it won't come up, then I would get a building biologist or an EMF specialist to check out your environment. And you might have a smart meter next to your bed. You might sleep with your cell phone under your pillow. You know, there's all kinds of different things that aren't smart to do, but you might be doing things right and still have a neighbor that has a super powerful Wi-Fi, or you have smart meters on your house, or you have dirty electricity in your house, or different things that can decrease your ability to make vitamin D from the sun. Now, we're doing things as a nation and a planet to reduce vitamin D ability to make vitamin D. One is air pollution. One is the chemtrails, you know, the spraying of the atmosphere with aluminum or other minerals to reflect the sunlight. I think they do that worried about global warming, or maybe they're doing it for some other reason. But that also can dramatically decrease your ability to make vitamin D if there's air pollution or particles in the air that are that are put there purposefully or just there because of volcanic eruption or there's a big fire near where you live. Okay, so COVID-19, D is good. I think the D that's good, the D that makes our innate immune system function better, meaning when a novel thing like COVID-19, the coronavirus, when it comes into our body, we don't have any immunity to it from like a prior infection or a vaccine. So we don't have anything. So our innate immunity helps protect us from that, and vitamin D helps that. Vitamin D also is effective in decreasing your risk of your immune system going overboard and causing the cytokine storm that creates the respiratory syndrome that kills a lot of patients or causes the disease. See those flies? They're trying to suck my blood. Causes severe disease, our own immune system overreacting, and vitamin D also is shown in many studies to help the immune system react appropriately. So hope this helps you. We don't have all the answers. Could be that the chemical signal in the pill is good. I doubt it. It's possible.